This recording will briefly cover routes of administration. I'm not going to lecture on each route, but I want you to study them on your own. And I have highlighted the routes that I want you to be responsible for at this time. There's some things like medications for eye, ear, inhalation medications that we'll discuss when we talk about medications for the respiratory system, medications for eyes and ears. But at this point, I want you to study the highlighted routes of administration, which include oral or enteral, sublingual buccal, topical, transdermal, rectal, vaginal, nasogastric, and gastrostomy tubes. And the suppositories refers back to the rectal and vaginal medications. For the parenteral routes of administration, I want you to be familiar with sub-Q, IM, and IV. Now we're going to go over some practice questions. Please pause the video to read the question and go over the answers and pick out your answer, and then resume the video to hear if you're correct. For practice question number 1, the correct answer is A. Metabolism and elimination affect the half-life of a drug. With liver or kidney dysfunction, the half-life of a drug is prolonged, and less drug is metabolized and eliminated. For practice question number 2, the correct answer is C. Creatinine clearance is the most accurate test to determine renal or kidney function. Creatinine is a metabolic byproduct of muscle that is excreted by the kidneys. Creatinine clearance varies with age and gender. Lower values are expected in older adults and female patients because of their decreased muscle mass. A decrease in renal GFR, or glomerular filtration rate, is common in older adults and results in a decrease in urine creatinine clearance. The correct answer for question 3 is B as in boy. Distribution is the process by which the drug becomes available to body fluids and body tissues. Drug distribution is influenced by blood flow, the drug's affinity to tissue, and the protein binding effect. This distribution can be affected by the effects of edema in the fluid overload phase. For question 4, the correct answer is D as in dog. Serum peak level is the highest plasma concentration of a drug at a specific time, indicating rate of absorption. Serum trough level is the lowest plasma concentration of a drug. If they are drawn immediately before the next dose of a drug that is to be administered. Trough levels indicate the rate of elimination of a drug. If either peak or trough level is too high, toxicity can occur. If the peak is too low, no therapeutic effect is achieved. Finally, question number 5, the correct answer is C. Drugs can be metabolized in the GI tract, however, the liver is the primary site of metabolism. If this question had asked most drugs are eliminated in the blank, which answer would you have chosen? If we were looking at which organ is most responsible for eliminating medications, it would be A, the kidney.